Welcome to this educational video on Microspherophakia, a rare and fascinating condition affecting the lens of the eye. Join us as we explore its causes, effects, diagnosis, and management. This video will provide a comprehensive overview to deepen your understanding of this unique ophthalmological condition. Microspherophakia, characterized by a smaller and more spherical lens than normal, typically arises from genetic mutations. The most commonly implicated genes are those involved in zonular fiber development or lens protein synthesis. Conditions like Weill-Marchesani syndrome, Marfan syndrome, and homocystinuria are frequently associated with microspherophakia. In rare cases, it can occur sporadically, without a clear family history or associated systemic disorder. Understanding the underlying genetic factors is crucial for both diagnosis and potential future therapies. The hallmark of microspherophakia lies in the abnormal lens shape. The smaller, spherical lens reduces the anterior chamber depth, increasing the risk of angle closure glaucoma. The zonular fibers, responsible for holding the lens in place, may be weak or absent, leading to lens subluxation or dislocation. This abnormal lens position affects the way light focuses on the retina, resulting in high myopia and nearsightedness and impaired vision. The altered anatomy disrupts normal aqueous humor flow, predisposing individuals to elevated intraocular pressure and subsequent optic nerve damage. Microspherophakia is a relatively rare condition, making it challenging to determine precise prevalence rates. It is most frequently observed as a component of systemic disorders like Weill-Marchesani syndrome, which affects approximately 1 in 20,000 individuals. The occurrence of isolated microspherophakia without associated systemic conditions is even rarer. Due to its genetic basis, a thorough family history is important when evaluating potential cases. Accurate epidemiological data is important for healthcare planning and genetic counseling. The clinical presentation of microspherophakia can vary, but common signs and symptoms include high myopia, blurry vision, and an increased risk of developing glaucoma, often angle closure glaucoma. Patients might also experience pain, redness, and sudden vision loss if the lens dislocates into the anterior chamber, obstructing aqueous outflow. A small spherical lens can often be visualized during a slit lamp examination by an ophthalmologist. Children with microspherophakia may exhibit poor school performance due to uncorrected refractive error or visual disturbances. Diagnosing microspherophakia relies on a comprehensive eye examination. This includes measuring visual acuity, refractive error, and intraocular pressure. Slit lamp biomicroscopy allows the ophthalmologist to directly visualize the shape, size, and position of the lens. Gonioscopy is crucial to assess the angle between the iris and cornea, determining the risk of angle closure glaucoma. Ultrasound biomicroscopy, ABUMEM, and anterior segment optical coherence tomography's AS, OCT, provide detailed images of the lens, zonules, and anterior chamber angle. Genetic testing can confirm suspected underlying genetic syndromes. While microspherophakia is often a standalone finding, it's crucial to classify cases based on any associated systemic conditions. For instance, microspherophakia associated with Weill-Marchesani syndrome presents differently than that associated with Marfan syndrome, and both differ from isolated cases. The underlying etiology drives treatment strategies and prognosis. Some classifications may consider the degree of lens subluxation and the severity of glaucoma risk. The management of microspherophakia is tailored to the individual's specific presentation. Spectacles or contact lenses can correct the high myopia. Miotics, medications that constrict the pupil, may be used to prevent lens dislocation into the anterior chamber but carry their own risks and side effects. Laser peripheral iridotomy can create an alternative pathway for aqueous humor outflow in patients at risk for angle closure. Lens extraction, typically through lensectomy or clear lens extraction, is often necessary to prevent or manage glaucoma and improve vision. The type of lens implantation, if any, must be carefully considered, especially in the setting of weak or absent zonules. Regular monitoring for glaucoma and prompt intervention are crucial to prevent vision loss. Currently, there is no way to directly prevent microspherophakia, given its genetic basis. However, genetic counseling is crucial for families with a history of microspherophakia or associated syndromes like Weill-Marchesani or Marfan syndrome. This counseling can help families understand the inheritance patterns and risks of passing on the condition to future generations. Early diagnosis and management of associated systemic conditions can mitigate some of the ocular complications. The prognosis for patients with microspherophakia depends on the severity of the condition, the presence of associated systemic disorders, and the effectiveness of treatment. Early diagnosis and appropriate management can help preserve vision and prevent complications such as glaucoma. Recent research is focused on improving surgical techniques for lens extraction and implantation in the setting of weak or absent zonules. Gene therapy holds promise for the future, offering potential to correct the underlying genetic defects causing microspherophakia. The development of stronger, more biocompatible materials for intraocular lens fixation is also an area of active research.